Hello, everyone. It's me, Dr. Marty Ross again, and tonight is one of our conversations with Marty Ross MD. This is the one time now that you have a chance to interact with me as I'm not doing the office hours anymore. So I look forward to being able to help you and give you some insights into what's going on. I know we got about, I think around 90 people, 85, 90 people signed up for tonight. So, and usually we only get about 50% of those people show up. So in other words, those of you that are here will probably have a good opportunity to ask questions tonight. I try as hard as I can to get through as many questions as I can, but you know sometimes I like to explain things, which makes me a little long-winded, but I hope that's worthwhile too. We'll get through as much as we can tonight, though. Um, in terms of how these webinars work, as those of you that are returning know, the way it functions is I ask that you write your questions in the chat box. And that way, and if you then would go ahead and send them to everyone, that means each one of us has a chance to read that question and see what we'll be talking about. I still will read them out loud because in the recorded version, the questions don't show up. So I still want people to understand what we're talking about. I am creating a recording, if you happen to notice that, and 99% of the time it actually happens. So I hope there's no gremlins in the system tonight. It looks like it's all a go here, but we'll see. But if everything goes as planned, I will go ahead and do some editing of that later tonight, get it posted up to YouTube and my video player called Wistia, and then tomorrow morning they will have a transcript for me that I can use to create headlines and add to the video. You know, when you watch it in the Zoom recording area, there's little bubbles there, and those bubbles correspond to the titles that I put below the video. So you'll be able to kind of skip through there as you want to, too. Okay. Uh, I think that's all I have to say for right now. Let's go ahead and jump in and get started here. So, hello. Let's see. I don't know who this is. It just says Zoom user, but I'm sure we'll identify who you are if I have any questions here. So it says, "Hi Marty. A family member is being treated with rifampin, clarithromycin, and methylene blue for the three Bs. Might it be a good idea to add anything to strengthen the regimen? Um, they are having some diarrhea with treatment, so we're wary of things that might be hard on the gut, like cinnamon clove, oregano oil. Thank you." So first of all, who is Zoom user? Could whoever that person is identify who you are? Oh, Tracy, it's you. I got it. Okay, don't worry. All right, so I want to talk about the antibiotics, and then let's talk about other things that really strengthen a Bartonella treatment. Okay. So, if we look at studies that were done at Johns Hopkins University over the last few years, one of those was a study looking at combinations of antibiotics and even herbs that would give some of the best benefit against Bartonella. All right. And in their study, they showed the combination of azithromycin with methylene blue, just those two drugs alone, were great at wiping out um, growing and persistent Bartonella and did a good job on wiping out biofilms as well too. Okay. Now, clarithromycin is in the family of azithromycin, and the way the Johns Hopkins studies worked, they were only choosing a drug of a member of each antibiotic class. So clarithromycin and azithromycin are in the same class. They're part of something called the macrolides. So if we were to look just at that Johns Hopkins study, the combination of your clarithromycin, which again is, I would say, is equivalent to azithromycin, and methylene blue should be really good for Bartonella. It also, based on my experience, would be good for Borrelia too. And when you throw in rifampin strengthens the Borrelia side and then also gets is another added agent that can help with at least growing forms of Bartonella. So I noticed you said three Bs here. It looks like you're just focusing on the Borrelia Bartonella side here, if I got that correct. If you're really focusing on the three Bs, though, this is regimen is not a Babesia regimen. Okay, I think you know that, but I'm just stating the obvious. Okay, now to try to get over Bartonella, you have to do more than just kill the germs. There are a number of other factors. I know I've mentioned here in a number of webinars, and Tracy, I'm sure you know what I'm about ready to say, but one of the things that's really beneficial is to do things, be aggressive about breaking down biofilm. The other thing you want to do is break down what are called fibrin nest, okay? So biofilms are a sugar slime layer that cover germs, and they are held together in a protein matrix made up of fibrin, which is the blood clotting protein. Fibrin nest are different than these biofilms. What a fibrin nest is fibrin, the blood clotting protein, and germs enmesh themselves together in these big bundles, and they stick themselves on your blood vessel walls. All right. So the commonality between fibrin nest and biofilms is that both of them act as a means of hiding the germ and making it difficult for your antibiotics to get at killing the germ, but also making it difficult for the immune system to do its job and help rid the germ as well too. All right. So at a minimum, to get at biofilm and get at fibrin nest, I like people to be on lumbar kinase. And if you're not doing that as part of this treatment, I would encourage you to add that in. Lumbar kinase is a group of enzymes that come from the skin of earthworms. I always find that humorous, but yes, we have to resort to some very interesting things in the world of Lyme disease. And I usually would have people start, there's two manufacturers out there. One makes a 16 milligram pill, the other one makes a 20 milligram pill. The 20 milligram is by a company called Baluki, and the 16 milligram is by Allergy Research. The last time I checked, I think the Baluki is still held up at the border. It's being shipped down from Canada, and it's just not making it in the States right now. That was the last time I checked. So I think right now it's just the Allergy Research product. I think we've been moving. I don't think we even have the Baluki, and I don't know how many people even have the Baluki out there right now in terms of stores. All right. So the Baluki, by breaking down fibrin, it's a fibrinolytic, will break down the fibrin skeleton of biofilms, and it will also break down the fibrin in the fibrin nest. I have people usually start at one pill a day, and after the Herxheimer that they're going to get from that, from more germ killing, goes away, then I have them go up to twice a day. Okay. Now, once you're stable on that, to get even stronger at biofilms, there's a lot of evidence. Dr. Mozignani in his little microscope slides has shown us repeatedly at iLads the amount of biofilm that is on these things. And so I really get aggressive about breaking down biofilm. So in this regimen, you're on methylene blue, breaks down biofilm, but I would hit your biofilms as hard as you can. I would do the lumbar kinase. Once you're stable on that twice a day, then I would go to a product by Research Nutritionals called BioDisrupt. BioDisrupt, and you do that 2 pills twice a day. It has multiple components that go up biofilms in a variety of ways. Number one, they break down the sugar mucopolysaccharide. There's enzymes that do that. There's proteolytic enzymes that may do a dent on the fibrin, but not quite as strong as the lumbar kinase does. It has a little bit of serrapeptase in it, which is a lot weaker at getting at the fibrin than the lumbar kinase is. In addition, there are a number of germ killers in there that go at and kill germs that are not tick-borne disease germs, but germs that inhabit biofilm. And there's a number of agents in there that keep the germs from attaching together, or the biofilms from swarming together and from adhering to tissues, basically. So it's and something that's needed. And so I'd get on the lumbar kinase twice a day first. Once you're stable, then I go to 2 pills twice a day. All right, on the BioDisrupt. Then I have a very strong theory, and I'm seeing some positive results from some of you that have been reporting to me, that one of the things that can happen in Bartonella is that you can get damage to the lining of your blood vessels. So your blood vessels have an inner cell layer called the endothelium. And inside of that, sitting just inside the blood flow area, is something called the endothelial glycocalyx. Your endothelial cells support the endothelial glycocalyx. The endothelial glycocalyx releases and makes something called nitric oxide when it detects blood flow going over it. That nitric oxide dilates up your blood vessels downstream, which makes it so you get greater blood flow into the really small blood vessels. And guess what? It carries antibiotics deeper into your tissues to kill Bartonella. All right. Now, one of the reasons, some people with Bartonella have air hunger. One of the reasons they may have air hunger is because of injury to the endothelial glycocalyx that makes it so that the blood flow through the lungs is not as good in the small blood vessels. And so you're not getting as good of oxygenation, oxygen delivery through the body then, basically. That's your air hunger. That's where it may be coming from. All right. Now, there are no studies that tell us they haven't been done. No one's done a study that says, is the endothelial glycocalyx injured as a result of Bartonella infecting the endothelial cells that line your blood vessels? But it's hard for me to believe they wouldn't be. All right. So I have been suggesting that people use a product which is called arterisol. It's basically an extract. It has in it an extract from a type of green seaweed, and the extract is something called ramen sulfate. And it's been shown to rebuild the endothelial glycocalyx. Where I have seen good results and where I started working with it first is in the world of long COVID. There's there is science in long COVID that shows that COVID destroys that endothelial glycocalyx. So we do know it does there, okay? And it gives good results in long COVID. So that's when I started thinking, I wonder if this could be something that would help in Bartonella treatment. So I also suggest adding that into your regimen at some point. Give it a good 3-month try. If you get benefits from it, then continue it through the duration of your Bartonella treatment until you get Bartonella out. Okay. The way I start it is 2 pills twice a day. Do that for a month. And then you go to 1 pill twice a day after that. So, for those of you, many of you may know I've started releasing on Thursday mornings. I send out a new newsletter. It's a weekly newsletter called TikCRAFT. And you might say that the issue I sent out this morning basically was the Bartonella issue. And what I just explained to you right here is exactly what I walked everyone through this morning in TikCRAFT. So if you want to see it written down, go to your email. If you signed up for one of my email lists, either at my Lyme disease information site, Treat Lyme by Marty Ross MD, or if you have bought something from my store and you allowed us to send you things through that email system, you are in my email system, right? And so check your email and see if you got TikCRAFT. It's TICKCRAFT from Marty Ross MD. You'll see it there. And you can start expecting you'll be getting it in your mailbox every Thursday morning with my tips and tricks, basically. Okay. All right. So I just wanted to address that for you as well, too. If you all have not signed up for it yet, or are not on one of my email lists, go to either my supplement store, treatlyme.com, or go to my information website, treatlyme.net. Scroll all the way down to the bottom. You'll see there's a place you can sign up for my email. Go to either one of those, and you'll start getting copies of TikCRAFT weekly. Okay? All right. So I just said a lot. Tracy, did that answer your question for you?
That was super helpful. I have a clarifying comment.
Yeah.
This isn't my treatment. It's a treatment for a relative who I don't actually live with. So I'm not super involved with the doctor, but I think that they are trying to address Babesia. So
Okay.
you saying
So
that's
there's nothing in here that does Babesia.
okay.
Well, let me put it this way. Clarithromycin can help. There in When methylene blue was first developed eons ago, um, there was some evidence at that point that it might kill Babesia or malaria at that point. And so we had hope that, as you know, Babesia is a blood cell parasite that acts a lot like malaria. And so, therefore, a lot of our approaches to killing Babesia are anti-malarial approaches. Okay. Um, what we have seen, though, and this isn't just my opinion, I know Dr. Tom Moorcroft, who does a lot of talking about Babesia treatment too, is of the same opinion. I don't think methylene blue does anything. I don't think it's a useful agent. So it is possible their doctor is thinking methylene blue clarithromycin is antibabesial, but I don't see it. And clarithromycin by itself would not be. The thing I would add to this existing regimen, if you wanted to do something that would make it better for Babesia, is I'd look at adding in Cryptolepis.
Hmm.
All the herbal Babesia agents we have, that is the strongest. in addition, it is useful against growing and persister Lyme and Bartonella. So you do strengthen your treatment by adding that one in. Now, the dosing regimens I use for Cryptolepis is aggressive. Okay. In fact, I was just on an interviewed by Dr. Eric Gordon out in California. Some of you may know of Gordon Medical
Mhm.
Associates. And we were talking, he was very interested in my herbal approaches. And it's for an event he's, I think, going to present live. It's a number of people he interviews, and I'll be one of the people. But, and, he's very experienced. And he's like, "You use that much crypto?" I said, "Yeah, because it works." So I just want to let you know where I exist is a little bit high on the crypto side. Okay. But Cryptolepis for Babesia, I try to work up to a teaspoon, which is the same as 5 milliliters 3 times a day. All right. When I'm using it mainly for Bartonella and Borrelia, and there's no Babesia present, I find success at 2.5 milliliters 3 times a day. Okay. So I just want to let you know the dosing difference. But if you're going to, talk with them about possibly adding it in to strengthen this as a Babesia treatment, I would, aim towards them working up to a teaspoon 3 times a day.
And I think this has been something that's been asked before, which is there potentially a reason to forestall the Babesia treatment while you're doing Lyme and Bart first?
Yeah.
Or is it okay to just hit everything at once?
It's a good question. So when I first started treating tick-borne infections in 2004, when I didn't know what I was doing, so one of my teachers back then, and teachers of most of us that are current day people that Lyme literate doctors that treat Lyme, is a guy named Joseph Burrascano, Dr. Burrascano. And so Dr. Burrascano is like the pioneer of treating tick-borne illnesses. He used to have a practice out on Long Island. He closed up shop about 10 years ago and is now doing other things in his life, but he was the pioneer and we all learned from him. So one of the things that he saw in his practice, and it was his observation, this is not with science, this is an observation, but unfortunately in tick-borne illnesses, sometimes that's all we get is observation, okay? But his experience was that if he had somebody with the 3Bs, that if he was using prescription antibiotics, not herbals, but prescription antibiotics, and he went after Babesia and Borrelia before going after Bartonella, he had worse outcomes getting over Bartonella. So what he advocated was trying to get your Bartonella under some control, not gone, but under some control first. So you would start by, if you've got somebody with 3Bs, you would start by treating Borrelia, Bartonella simultaneously. And then as you start seeing decrease in what I would call Babesia, or I'm sorry, Bartonella symptoms, things like pain on the soles of feet, mental health problems, neuropathy starts getting better. Maybe some of their air hunger gets better, although air hunger can come from Babesia too. But you've tracked what we sometimes look at as Bartonella symptoms, and as they start getting better, then you can add in your Babesia treatment. Okay, and that's with the prescriptions now, and that's how I
Mm.
practiced in my practice as well too. I don't think that argument quite holds, though. If you're using an all herbal regimen, I have found that you can go after all three at the same time with the
Mm.
herbal regimen. Okay. And a good herbal regimen to go after all three at the same time, many of you know, is I like using Cryptolepis, Japanese knotweed, and liposomal cinnamon, clove, oregano. The clove and crypto is what goes after the Babesia. The and then the crypto, Japanese knotweed, and cinnamon clove oregano go after both Lyme and Borrelia growing and persister states. Plus, the cinnamon clove oregano oil can do some partial breakdown of biofilms as well too.
So it's more when you see the symptoms dissipating rather than a time frame of how long you treat the first two. Okay. And is cognitive decline, is that considered a symptom of Bartonella?
It can be, although it can be also part of Borrelia too. That one trick or one tip that sometimes suggests you have more Bartonella cognitive decline than a Borrelia decline is if you have severe cognitive decline or a cognitive decline that is relatively greater than your energy decline. So let's say
Mm,
your energy is 50% of normal, but your brain function is 30% of normal. That means you have a more severe cognitive decline. Okay. And so in situations where the cognitive decline is much more severe relative compared to your energy decline, think Bartonella
versus, were you saying Babesia or versus Lyme?
versus Lyme.
Versus Lyme. Okay. All right. All right. That's super helpful. One last quick thing. You said biodisrupt. You prefer that to biocidin?
I do. I've found better effects from it. It's just my preference. I mean, you are correct. You could look at a biocide which has multiple ways it also attacks biofilm. Problem with biocidin though is when you add it in, it has some anti-Bartonella and anti-Borrelia features, which means you're adding more germ killers in a situation where you're on tons of germ killers. You don't necessarily need to do that, basically.
Mm, okay. All right. Thank
And I even though I advocate killing germs, you try to go use what you need to do to kill the germs, but don't overkill the germs because if you put people on 4 and 5 and 6 things to kill the germs, there's a greater chance you're going to injure the intestinal microbiome. We
So
have to
the
keep that in mind.
biodisrupt is gentler on the intestine.
Yeah, because it doesn't kill anything.
Uh-huh. Okay.
It's just literally something that breaks up biofilms. It's not going to injure the bacteria in the intestines.
Okay. That was a lot of information and extremely helpful. Thank you.
Well, I hope it helped. I hope it helped everyone here too. Did anyone else have another question around that? Okay, let's move on here. Hello, Trish. Let's see. This is 2 quick questions. Trish, your questions are never quick. No, don't worry, I'm teasing.
I
Let's see if they're quick tonight, okay? All right, but I always talk too much too, so we'll see if this is quick, all right? Let's see, 2 quick questions. So much chatter online how poor testing the real-time labs is. They are saying it only captures the molds we eat from foods. I know you recommend this test. I was looking for environmental modes thoughts. Okay, I'm going to answer that one first. All right. So, a competitor of real-time labs is a lab called Mosaic Diagnostics, I think they're called Mosaic Labs or Mosaic Diagnostics. They used to be called Great Plains, and then they changed their name to Mosaic. Okay, so they do a urine mycotoxin test as well too. It's a different technique than is used by real time. Real time basically does something called an ELISA. We're using antibodies that will hold on to mycotoxins so you can see if they're there. Okay, versus what the method is that Mosaic is doing. It's something called chromatography. It's basically a way of measuring is there gas, mold toxin gas in there. It directly measures gas. Okay, it's the same method that Vibrant uses and how it does its studies as well too. All right, now trying to answer this question, do we have to be worried about toxins in our food? Because yes, it's true that some grains can have aflatoxin in them, um, and there's other toxins that might be on food. All right. So what they did at Mosaic, trying to see is this something significant? They did a study where they measured in people how much toxins were in their urine, and then they had them binge on contaminated food that had tons of aflatoxins and other toxins on it. And then they tested again. The bump up in those toxin levels that came from food in the lab test was minimal, below what they call their standard that says you have toxins in you. Okay. So, yes, you can get toxins from your food source, but it is insignificant in terms of what's going to accumulate in your urine tests, basically. All right. So, with that in mind, they did a couple studies looking at that. I think if you look back at my TikCRAFT newsletter last week, I think I brought that up in last week's TikCRAFT newsletter. Okay, so I had that in there, right? So in other words, I think it's nothing to worry about. If it's of a significant level that the lab says is not borderline but above normal, that is from environmental toxins. It is not coming from your food. Okay, all right. All right. Number two, I took the yeast test at the end of book. I scored over 175. I don't have the typical yeast overgrowth with stomach issues or even vaginal issues. Mine are more sore tongue for 20 years and so much neuro symptoms. Do you still feel it's yeast overgrowth even if it's not typical symptoms? So, so that tool. So first of all, have you ever treated yeast before, intestinal yeast before?
No.
Okay. So that tool, that screening tool, that questionnaire you fill out has a few components. One is it looks at what are the things that you've done in your life that might have killed too many bacteria. Okay. It also looks at symptoms that we might see with intestinal yeast. And so it's a backward looking screening tool. All right. Now, the reason I asked you if you'd ever treated yeast before is the score on this is only relevant if you've never treated yeast before. All right. Because if you've treated yeast before, it's a backward looking thing. It doesn't account for the fact that you might have tried to kill yeast already. All right. And so it's going to be overweighted on historical things like did you use antibiotics 5 years ago? Were you on steroids in the past? If you've already handled yeast, it overweights those historical things that you've done. All right. So anyone interested in using my questionnaire, it's only relevant if you've never treated intestinal yeast before. Okay. All right. And what I have found in my practice is if people score over 140, that generally most people get benefit from killing intestinal yeast. All right. Now, I want to be clear. It doesn't fully diagnose. It just says the odds that you have intestinal yeast overgrowth are pretty high. And a lot of people with that score get better. All right. It's open for interpretation. So, like if I have somebody comes in my practice, they score really high. I also do look at a few things. I ask, do you have sugar cravings? Do you have intestinal gasiness or bloating? Do you have any problems with eczema or pimples? And do you have any problems in a woman with repeated vaginal yeast infections? And if all those come back no, I'm disinclined to go after yeast, even with a score of 175. It's not a perfect world, right?
Right.
So if you really don't have those symptoms, those core symptoms that I was just talking about, I probably would not go after it.
Okay, fair enough. Is there a way to get your older versions of the email or your newsletter?
So, so are you on my email list at all or not?
No, not yet.
Oh, you have to sign up. Um, no, I'm not. I'm trying not to be facetious here. Um, I'm trying to figure out how, so there it's not an easy system right now. I'm trying to make it easier. The trouble is it gets buried in all of my other emails that I send out, right? So whatever the last so there's a place I use MailChimp and basically you can access everything in the order that it went out. So there's not one place you can go get TikCRAFT versus my product promotion emails. They're all mixed together basically. So it's a little bit complicated. Um, let me think about how I might get those to you. Okay. And I have
Okay,
your email. I can get your email for you. Okay.
thank you.
All right. Anyway, I'm working to fix that, but right now that's the awkward system that I have, basically. All right. All right.
Thank you.
You're welcome. Um, Seraphima, I see that you got your hand up there.
Hello, thank you. Can you hear me now?
Sure, I can hear you fine.
Okay, I'll try to make it as brief as possible because I'm new and I know other people have been here before.
Yeah.
I'm blurred out because I'm trying to move out. That room is a mess behind me.
Mhm.
Um, so since 2018, I had not found your protocol yet. I'm a couple of days old discovering your website, actually. So I'll keep it brief because I've tried other protocols
Okay.
that didn't really.
Seraphim, I just have to ask a question. So
Yes.
what I try to do, the way this group works is I take questions that are written to me so that we can save a lot of the time of getting the information out, like you're about ready to do. Okay. When I take questions after I deal with somebody's question, it's only supposed to be pertaining to the topic we just talked about. So, is what you're about ready to ask me a follow-up question to what I talked with Trish about, or is it a different set of questions altogether?
It's different altogether.
Okay, so what I would like to be able to help you, but other people have already written questions too. I would ask that you briefly write what it is you want me to help you with in the message area, and hopefully we'll have time to get to it today. Okay?
Okay, thank you.
All right. Yep. And by the way, Seraphima, welcome here. All right. Let's see, Kara. I know fluconazole and methylene blue is a possible Bartonella treatment. Assuming also itraconazole with methylene blue, that's a question. Would azithromycin and rifampin no longer even be needed? Nystatin necessary if you're taking itraconazole. Okay, so again, one of my favorite treatments is the combination of methylene blue and fluconazole for Bartonella. And we know from the Johns Hopkins lab experiments, that again, methylene blue is good for growing and persister Bartonella breaks up biofilms. Okay. The way that I came up with the idea of using fluconazole, and now a number of my other colleagues are doing it as well too, but how I started doing it initially is if we look back at the Johns Hopkins experiments over maybe about 4 or 5 years ago, they did an experiment where they took a representative of each drug class to see what it would do against growing and persister Bartonella. And for this class of medicines called the azoles, fluconazole is an azole, itraconazole is an azole, they chose a representative drug called clotrimazole. Clotrimazole is basically used in anti-yeast creams. All right, so it's over the counter. It's horribly absorbed if you try to do a compounded version. And so I never tried the compounded version, but I was really intrigued by how effective the clotrimazole was in the experiments. And so I don't know why, but suddenly one day I was thinking, it's like, well, heck, if it's a representative drug, why don't I try fluconazole and see if it does something? Okay. And wow, did I get some good benefits with that? All right. I will also, but there are times that I find I will, as an alternative to fluconazole, itraconazole is a good alternative as well too. All right. Usually when I get to itraconazole, how I get there is I'll start fluconazole first. But if I have somebody that I'm using it and they also get yeast while on fluconazole, because you can get yeast resistance to fluconazole and the azoles. If that happens, then I will switch over to itraconazole. All right. The other times I'll use itraconazole is if I've got somebody I've been doing a methylene blue and a fluconazole regimen and they suddenly just stagnate. We're not going forward. I don't find any evidence of intestinal yeast overgrowth that's spitting out cytokines, making them feel worse. I sometimes will throw itraconazole in as an alternative to the fluconazole, wondering maybe their Bartonella got resistant to fluconazole. And I have seen some really, really promising results with that. So in reality, I usually start with fluconazole, but I think you could go with either one. I prefer, though, to start with fluconazole so I can save my itraconazole if I start getting into intestinal yeast problems when somebody is on it. It's a stronger anti-intestinal yeast agent than fluconazole is, basically. All right. Does that answer your question? Oh, the other part of your question is, if you're on an azole methylene blue, you do not need to be on azithromycin and rifampin
Like at all.
for Bartonella.
No. Okay.
However, if you are also trying to treat Borrelia, though, I would look at probably adding azithromycin to that regimen. And here's why. So the methylene blue for the spirochete form of Lyme and intracellular Lyme, your itraconazole is not going to go after spirochete. Methylene blue might go after it. Azithromycin definitely does. All right. And azithromycin methylene blue combination, as I was just explained earlier, is a pretty powerful combination just by itself against Bartonella too. So if you're trying to go after Borrelia, the itraconazole, fluconazole actually will. All right. So let me start over again. Borrelia terminology is really hard. Okay, so there are forms of Borrelia, and then there are growth states of Borrelia. All right, so the forms, the appearances, what it looks like, there are something called spirochetes. They're the little corkscrew things you probably have seen on the internet. Okay, There's a form, something called L form. It's what lives inside of your cells. It literally sheds its covering and moves inside cells. All right. And then there's something called a cyst form. It's a microscopic cyst. It's not cyst you feel on your skin, but it's microscopic. All right. Now, these three forms can either be growing or persisting. All right. So when you design a treatment, you need for Borrelia, you need to make sure you're doing something that's going to go after all forms, as well as something that's going to go after the persisters. All right. That's how you got to do it. All right. So itraconazole methylene blue would be weak on intracellular Borrelia, and it would be weak on spirochete growing Borrelia as well too. So that's why I would add in this azithromycin there.
Would does Cryptolepis, is that strong on Borrelia?
So if you want to step outside the prescriptions, which is great, you could add a Cryptolepis into this. You get a stronger Bartonella treatment on both growing and persister Bartonella. Cryptolepis is really good at growing and persister all forms of Borrelia as well too.
Okay, so Rifampin would really not be needed with itraconazole. Yeah.
And
Okay.
actually, I wouldn't do Rifampin with itraconazole. So there's
Because
a
they don't
there's
go together.
well, no, there's a safety reason. There's two issues actually. One is both the azoles and rifampin can inflame the liver. You do not want to take two drugs that are going to inflame the liver. Okay. All right. Number two, I forget how this works exactly, but I believe being on an azole lowers the drug levels of the rifampin, or it's the other way around. But there's an issue with one messes up the metabolism
Mhm.
of the other, basically. So I in my practice, I don't use the two at the same time.
Okay.
Yeah.
Okay.
All right.
Okay. Yep.
Good. All
Thank
right.
you.
You're welcome. Anyone else have any question about what I just talked with Kara about? Jim.
Yeah, just to follow up, if you're talking about adding an herb to that protocol, if you weren't very good with Cryptolepis, what other herbs would you might try to add to that?
So I'd probably go ahead and add, you could either add Japanese knotweed, and that would turn that into a good Borrelia treatment, because Japanese knotweed is good for growing and persister Borrelia all forms. The other option would be to add in a liposomal cinnamon clove oregano essentials. And again, those oils in combination are great at growing and persister Borrelia and Bartonella. They would knock out all forms of the Borrelia. You get a little bit added benefit in that combination over Japanese knotweed at biofilms as well too. You get some help from biofilms on the cinnamon clove oregano. So you could go either way. The more mild way, the one that may give you a less strong Herxheimer reaction, would be the Japanese knotweed. I find the cinnamon clove, if I were to rate these, I put crypto, this is based on clinical experience, okay? I'd say crypto is your strongest. Your cinnamon clove oregano is probably just a little bit below crypto. Japanese knotweed is down here. Still effective, but it's a little bit lower. So if I've got people that are really sensitive, I might grab my Japanese knotweed before going a crypto and before going a liposomal cinnamon clove oregano.
Okay, so for a Bart and Borrelia protocol, are there any other herbs that might be useful?
That's a good question. So, any of those oils I just told you about, the knotweed, the crypto, the Buhner out of Buhner Herbs, a master herbalist, advocated using Houttenia and Siddha Okuda. And in fact, I used a lot of the combination of Houttenia, Siddha Okuda. The problem and why I've shied away from, and I had good results, but we have no studies that tell us and Buhner claimed to be the guy that anything he recommended had to have science. Well, garbage. I mean, I love Buhner, okay? I think he was a very valid guy, but if you look at what he called science, there was a lot of stuff that was not supported by science. There were no studies ever done looking at, does Houttenia kill a Bartonella? None. He just looked at its action against other bacteria and assumed it would take care of Bartonella. Okay. Same with Siddha Okuda. I will tell you though, I did have good benefit, but the problem what we don't know, and I think most of us these days are really trying to address persisters, and we have no evidence that um, that those herbs get at persisters, and a lot of us think it's the persisters that are one of the things holding us back from getting over Bartonella. So for that
Okay,
reason, I tend to shy away from Houttenia psittacuta, but those are other alternatives. But if you add them in, just be aware, I do see good clinical response, but I'm suspicious that it's picking up persisters.
okay, great. Thanks very much.
You're welcome. Ken, I see your hand up there too.
Yeah, thank you. Is it very common that when you have Bartonella, that you can get the sort of neuropathy on the bottom of your feet?
So Bartonella can give neuropathy. So Bartonella is known to infect the nerves, and also and so it's, that's partly why it gives such cognitive thinking problem issues relative to Borrelia, like I was describing earlier tonight. But it also can give a variety of neuropathies as well too. So it could be numbness, can be burning pain, any type of neuropathies can be Bartonella. It sometimes also gives a lot of anxiousness, ongoing anxiety, not panic attacks, but ongoing anxiety. It can give depression. It can give psychiatric problems. It can give tremors and shakes. Kind of an odd symptom that people get with Bartonella is they have internal vibrations. They feel like they're shaking, but it's not visible. So if somebody has and then pain on the soles of the feet, that's not
Yeah.
neurologic pain, but an achy pain. So yeah, it could be. Now keep in mind, and then I'll hear what you're gonna say. Keep in mind, Borrelia can give neuropathy though too.
Okay. I have some neuropathy on the bottom of my feet. I talked to you about this once before because Armin Labs thought I had Borrelia or Bartonella. I'm sorry, and I showed you the results, and you didn't think it was very positive. So I wondered whether I should go to California and have that checked again. Does that make sense?
So I think that's what I would do. I think you're better and trying to consider if you have Bartonella, because I know um, Ken may. I mean, is it okay if I talk to you clinically? I don't want to over disclose privacy here.
No, absolutely.
Okay. So I know in working with you in the past, is it okay if I say that
Sure,
is it okay
absolutely.
I talk about that? Right. So I was left more with the impression clinically that you had Borrelia. However, um, if you've gone after we start thinking about, is there something I'm missing as a co-infection? If all the things you do going after the main things you think are there are not working, you got to start wondering, is there a missed co-infection? Is there a co-infection that was not obvious to me either because of testing or the clinical picture did not scream that this other infection was there? Okay. So yeah, your odds, if you have done years of treatment, you're not getting a lot better, or you have some remaining symptoms, that kicks up the odds that there is possibly an underlying co-infection that just wasn't as apparent as your Borrelia might have been. Okay. And
Yeah.
these days, the immunoblot testing method out of IGeneX for Bartonella has a sensitivity at finding Bartonella if it's there of 94%, I believe is what it is. So sensitivity means, can it find it when it's there? Okay. And so the immunoblot is more sensitive than even with the Armin test that you did before. Armin is an ELISpot. The ELISpot sensitivity is probably more around 85%. So the immunoblot is much better at finding it if it's there. So yeah, I would recommend, and I would do both an IgM antibody immunoblot and I would do an IgG antibody immunoblot. And let me just briefly explain that. So many of you know IgMs are what you get when you have acute infection. They're supposed to go away, and then you keep making IgGs. For some, in the world of Borrelia, we see about 50% of the time that IgMs don't go away, and we don't know why for sure. Okay, there's more recent evidence coming out of IGeneX lab that on immunoblot studies, where they're seeing positivity years after somebody's had Bartonella as well too. So on the IgM. So IgMs may have meaning. So I still test for them even with somebody with chronic infections as well too.
Thank you, Marty. I think I will do that. Get tested again.
Good luck to you, Ken. Good seeing you.
Thank you.
Yeah. Does anyone else have a follow-up question on any of that? All right, let's keep working through it here. Hello, Lisa. Let's see how Dr. Ross. My daughter has been under Babesia regimen for a few months now. She started in October 24, but took it low and slow and didn't reach full dosing until mid-January. If this is going to work, when would you expect to start to see improvement in symptoms? She has yet to start lumbar kinase yet, so I know that needs to be rolled in, but I had hoped for a bit of improvement first. Would love to hear your thoughts on this. Okay. So as I remember from before, Lisa, I believe she's on the tefenoquine, azithromycin, Mepron or Malarone. Is it Mepron or Malarone?
Malarone.
Okay. So she's on a strong treatment. Okay. I just want to let you know.
Okay.
So, but it took you a while to get up to full dose. All right. So what I usually see, if you're on a regimen that is working, it may take 2 months at your full doses before you start seeing some improvement in the Babesia symptoms. I didn't say they're going all the way away, but I said seeing some improvement. Okay. If not, I definitely at that point would add in your lumbar kinase.
Mhm.
All right. All right.
Okay.
You could even consider adding it in now because we know that like Bartonella, Babesia forms these fibrin nests too. Especially if her Bartonella is a strain called Babesia odicoli, we know that that is the strain that really develops these fibrin nests. The Babesia Macrolides probably does not develop these fibrin nests, and the Babesia decani probably does not develop fibrin nest, but the odicoli does. And you can get significant uncovering of the germs by using lumbar kinase, right? So, if she's stable for a while on the current regimen she's on a strong regimen, then even before 2 months at this max dose regimen, you might consider adding a lumbar kinase, and you're probably going to need to do it. So you might even consider doing that as well too.
Okay. And then also the biodisrupt you were saying would also be beneficial.
She doesn't, so Bartonella is, so lumbar kinase again can break up fibrin nest and can help break up biofilm. All right.
Mhm.
Babesia just has fibrin nest. Babesia does not have biofilm issues.
Okay. Gotcha. All right. Thank you. Thanks for
All right.
keeping it straight for me.
You're welcome, Lisa. Good luck. Good luck to your daughter, that is. Yeah. Did anyone have a follow-up question on Lisa's questionnaire? All right, let's move on here. Hello, Jim. Let's see. Burning sensation, neuropathy, paresthesia. This relatively new symptom often wakes me at about 6 a.m. Tingling, burning, pins and needles sometimes leads to a sweat. What do you think is causing this? Bart, Babs, mycotoxin. What can I do about it? Someone I spoke with today suggested gabapentin. What do you think of that? Thank you so much. All right. So if I'm understanding you correctly, so Jim, I'm going to have a question for you here, but I just want to make sure I understand this correctly. So this is only happening after you've been laying down for a while. Is that kind of an accurate way of looking at it? Oh, your microphone's muted there, Jim. Still muted. Huh, it's not unmuted. Oh,
Okay.
there you are. Hi, Jim. Looks like you changed devices there. Yeah, okay, got it.
Yeah, I was on both my phone and the computer because I had so much trouble with the computer.
Yeah, okay, so no problem. So anyhow, if I'm hearing you correctly, this is occurring while you're laying down and you've been laying down for a while. Is that correct?
Yes, it is.
Okay. What part of your body are you getting the pins and needles and the burning?
It's generally my upper torso and my arms. Sometimes my face, usually not the legs.
Yeah.
And sometimes, in the summer, I think I throw the covers off.
Okay.
And with less warmth, it does abate a little bit.
But again, this is not happening when you're up and about during the day, and it only
Never,
occurs after
never.
you've been laying down for a while, is what yeah, okay.
In fact, it only happens at night after I've been laying down because
Yeah.
in my bed.
Yeah. Okay.
Because
So
in the daytime, I lay down quite a bit on my couch. It's never happened.
yeah. So I'm going to suggest that you talk with you can do a primary care doctor could help you with this, but somebody needs to evaluate your spine to make sure that you don't have osteoarthritis occurring at one of the levels that has
Wow.
developed bone spurs that is positionally, when you're laying down, pushing on your spinal cord somewhere. Okay. And so the reason I'm saying this is positional. This is not going on during the day. Bartonella neuropathy, Borrelia neuropathy is not going to come and go at certain times. Well, Borrelia can come and go at times, but it's not a positional thing. This is, I'm laying down after 6 hours. So I have to wonder, something is pressing against your nerves somewhere. And the most common possibility is something in the spine, basically.
That's interesting. That's interesting. But the thing is, okay, let me just, I will look into that for sure.
Yeah, yeah. And Jim, even a primary care doctor, you can just say, every time I lay down for 6 hours, I start developing this neuropathy. It could even be up in your neck, depending, how your pillow is and everything like that. But they should be able to start working through that with you, or if not, ask to see a neurologist on it.
Okay. Could I continue to follow up on the Bartonella aspect?
Sure.
Because listening to your other answers just tonight, so I do have other neuro symptoms besides this neuropathy.
Yeah.
And I do have the anxiety. There are days when I wake up and out of nowhere, I'm just like crazed with anxiety and despair, feeling like I'm never going to get better, et cetera.
Right.
And it's not always that way. But, and the other, let's see, where did I put my notes here? Yes, so earlier in my illness, which has been going on for years, it was definitely more about the energy, and the cognitive stuff and the psychiatric stuff and the neuropathy stuff have really gotten more prominent in the last year.
Okay.
Since I moved to a new house.
Right.
And I've just actually had the mold inspector here today. There was some mold in the ceiling of my bedroom.
Yeah.
From a roof leak.
Yeah.
That was, and so what I was thinking with this burning thing was, I was sleeping in this room, and I'm thinking the reason I'm getting this in the morning is I've been inhaling this stuff all night. Now, I'm now kind of moving a little bit off of that theory. The other thing is I did have the real-time test last August, and I was positive for all 4 categories of mycotoxins.
Right, right.
So,
question for you. Were you already in this new house when you had the real-time test done in August?
I was.
How long had you been in the house?
6 months.
Okay. So
and when I first got the positive result, I assumed it was from my old house.
It could be because, again, the issue with mold toxins is when you breathe them in from your environment, they get trapped in you. So you could have breathed them in 2 houses ago, 5 work sites ago, right? And if you've never done anything to remove them, they're just a swimming pool that keeps recirculating in you. Okay.
Yes.
But it may be that you've got 2 things going on. One is something is pressing along your spinal cord, right?
Okay.
That's the laying down part. And your nerves may be more inclined to be bothered by this because they're also in a swimming pool of toxins, and you have Bartonella, right? So it's basically an environmental issue making a mechanical issue worse. Does that make sense? Yeah.
It does. It
Yeah.
does.
And the thing that makes me wonder about the environmental issue making it worse is overall you got worse moving into a house that has mold. So you got to wonder, did you get more of an exposure basically too?
Yes.
So I would still suggest to you, working on your cleaning out your house. I understand that's not the easiest thing to do, but getting that remediated but then working with binders to bring down your mold
Yes.
toxin levels.
Well, I've been
But
doing
I'm
that.
still,
I've
but
begun that.
because, but I do wonder if you've got an anatomical structural issue as well too. And I would see if your doctors would help you look at that as well too.
Okay.
Yep.
All right. In terms of, aside from finding that out, do you think that in terms of just doing something to relieve this symptomatically, which might also help my sleep, would gabapentin be a good idea?
So gabapentin is a prescription medicine that is basically binds to something in our brain and in our nerves called GABA receptors. And if you bind to a GABA receptor, it decreases nerve pain and nerve sensitivity. Okay.
Yes.
And all right. The other thing is it can be sedating as well too. All right. Now, so yes, it could help with the pain. It may help you sleep. And usually you can get by, most people can get by with a nighttime dose. You can do 300, 600 milligrams. All right. Now, having said that, there's starting to be newer evidence coming out that shows that long-term use of agents that bind to GABA receptors may lead to permanent thinking decline.
Ooh.
All right. And so the other thing that binds to GABA receptors is your benzodiazepines, because actually your GABA receptors are called the GABA benzodiazepine receptor. Okay. And so anything that you use long term, I'm okay, I think, with people using these medicines now short term, or if there's nothing else to use to get out of the situation long term, but you have to be aware there may be a small risk of getting into permanent thinking problems from them.
How about taking GABA itself as the supplement?
You could, but again, I think it's the same issue. Long term, short term is fine. Long term could be a problem. You could use as an alternative to GABA, you could take L-theanine. So
yes, I've been taking that.
Yeah, because it basically in the brain, it's turned into GABA.
Oh,
yeah.
Okay.
All right.
Thank you. Okay.
Good luck to you.
Thanks so much.
All right. All right. So Joyce, you had your hand up there.
Yeah, as far as Jim, I can give you a suggestion that you could actually try tonight. I just recently went through something that you're talking about with the neuropathy, and
Yes.
I moved across country to a new place, and so I started to think back because I really tried to figure out what's going on. So of course, with moving, you're lifting boxes, you're doing all these other things. We were on an airplane. I had some issues with the seat on the plane, neck issues and all of that. And then all of a sudden, one night, I started having this numbness in my legs, and it scared the heck out of me because I moved from Arizona, no ticks, to North Carolina, ticks everywhere. So I thought, well, maybe I got bitten again. And I let my brain go down a rabbit hole. But I pulled myself back together. And what I did was I got on my yoga mat and I just did this simple thing. I had so much neuropathy and it was in my legs. And I just got on the yoga mat, lay on your back, put your feet flat on the floor, bring them as close as you can to your buttocks. And then just make sure your hands, your arms are laying next to you, palms up, 20 minutes. Don't be tempted to look at your phone in your hands because now you're moving your spine out of alignment. And it really does help the spine to realign. Try to get to 20 minutes. I did that several times, per every day, not several times a day, but number of days in a row. You can do it like 2-3 times a day, whatever you can. And no neuropathy, everything went away. So it might not be for you, but it worked for me. And it was really scaring me because I thought, more problems in addition to all the other stuff I'm going through. So I hope that helps.
I hope it will too. Thank you.
Yeah, like Dr. Marty Ross said, it's probably something structural, maybe with your moving, maybe with all the other things you went through. You just knocked something out of alignment in the spine. You might have done, usually if it's legs, it's the lower part of the spine. And if it's, arms, it's hands, it's the upper part of the spine if you're having neuropathy. So I don't know if that'll help, but I hope it does.
Thanks, Joyce. It's a reasonable idea. I mean, again, one thing I would say for both of what you both have said here is, we have to be careful, and you all have heard me say this before. We have to be careful not to put our Lyme blind or tick-borne illness blinders on. People with tick-borne infections, mold toxicity, get things that happen to normal people, right? So the clue to me to think outside of tick-borne infections, mold toxicity with you is this is a positional thing, right? The position of laying down for long periods of time brings us on. You have to think of structure. Joyce, in your situation, I would have thought of structure too, because this happened after a move cross country where you were kind of all bent up in a sense, right? So yeah, I would have thought the same thing. So I would just use that as an example. Be careful. Not everything that happens to a person with tick-borne illnesses is tick-borne illness. Yeah. All right. All right. Jim?
Yes, I just wanted to say that it's not always when I've been lying down for, well, two things. One is, the bedroom that had the mold, I had workmen there ripping the place apart and fixing the roof. So I moved into a different bedroom.
Yeah.
And I continued to have the symptoms. But I also spend some days, maybe most of the day lying down.
Yeah.
But downstairs on my couch. And I've never had it. And that's one thing. And the other is last Saturday night, I decided to try going back into the bedroom where the mold had been.
Yeah.
And I went to bed, and within an hour, I was having this symptom and just.
Yeah.
And it's also sometimes accompanied with air hunger, which I forgot to mention earlier.
So as I said, it might be two things. Still with the fact that often, most of the time, this is coming on in a position. You have to think of nerve pressure, okay? But then also that ability for something to irritate your nerves is going to increase if they're already irritated with something infectious or toxins, right?
Yep.
It just makes you more sensitive, basically. Yeah.
Thank you.
You're welcome. All right. Let's see. I thought I saw, Kara, I do see you there, but I thought Tracy had her hand up too here.
I did, but he answered my question. I was going to suggest that he try sleeping in a different room, but he already did. So
okay, good. All right, good. Thank you. Kara, I see your hand up.
Yeah, I was just wondering, I found L-theanine very helpful for sleep also, but I just recently started trying melatonin, and I don't know if that is a good idea or not for sleep. I have read different things on it, and so, but it is really working.
Then stay on it, and it's a good option, actually.
And then what do you think about phosphatidylserine for helping with with neuropathy? Do you think it is helpful?
So when people have neuropathy, there's a couple that, if it's due to toxins and infection, yes, deal with those, lower your toxin load, get your infections under control, okay? But once the nerves are injured, there are steps that I like to take to repair the nerves. One of those is to fix the phospholipid membrane, the fat. So your cell membrane, any cell membrane, is a bunch of fatty acids, a double layer. We call it a phospholipid bilayer. Okay, that gets injured. In addition, inside of your nerves, when you have neuropathy, that usually means you also have mitochondrial injury. Your cell energy factories called mitochondria are injured. All right, and the mitochondrial membrane is also made up of phospholipids. In addition, so you want to do something with neuropathy that is more of a persistent neuropathy to repair the nerve cell membrane and fix your mitochondria. Okay, now you want to repair phospholipids. The trouble with phosphatidyl, did you say serine or choline?
Serine.
All right.
Serine, yeah.
So phosphatidylserine is only one type of phospholipid that makes up your nerve cell membranes and mitochondrial membrane. What I prefer to use to do phospholipid repair is a product by Research Nutritionals called ATP 360. And it has the full range of phospholipids that make up both the mitochondrial membrane and your nerve cell membrane. All right. In addition, it has a number of micronutrients in it that help the mitochondria work better. and it's got a substance called PQQ in it that causes your body to make more mitochondria. So it causes mitochondrial biogenesis. All right. There's good studies that look at what happens when people are on it, and there is improved thinking. I think thinking went up 30% in the study group. Energy level went up 50% in the study group. I mean, there's real changes that happen. There's better immune function as well, too, that happened in the study group. Okay. So it's a good product and it's research. So that's 3 pills 1 time a day. I also like in neuropathy and in mitochondrial dysfunction, I like to work with decreasing oxidation damage that occurs in these situations. So I like people on glutathione. Glutathione inside your mitochondria does not make a lot of it. And so if it's injured, it will exhaust its glutathione supply and then it can't heal from the inside. Same with nerves. If they get injured, they're going to not have enough glutathione. They'll use up their glutathione trying to repair themselves from the inside. So I like using liposomal glutathione by Research Nutritional's product called Trifortify. The reason I like their product is they've got research showing that cell levels go up about 45% when somebody is using their formulation. All right. I mean, that's what the science tells us, right? And so there's a lot of other products out there that claim to get absorbed, but they don't have any science that shows it. These guys do have science. All right. So I would do a teaspoon once a day on that as well, too.
Okay. I was trying to think what might help him.
Yeah. Yeah. All right. Good luck to you. All right, let's see here. Lisa, I see your hand up, and then I'm going to take one more question on this question, and then I'm going to move on and start taking some other questions too. Lisa, what do you got there?
Just a quick backtrack. Are you saying that the supplement GABA has the same cognitive decline or relation to cognitive decline as, oh, okay, wow.
Well, no, it's a good question. I'm shaking my head. That's a good question.
Okay.
The truth is, I don't know.
Okay.
But given some of the stuff we're seeing now with gabapentin, people that use long-term benzodiazepines, I would be cautious.
Okay.
Yeah.
I saw that it was just, there are some states want to include it on their controlled substance list as well, the gabapentin. So I just saw that.
That one, I don't understand why. I don't understand why in that one.
All right. Well, thank you for clarification.
You're welcome. You're welcome. Okay, everyone. I know that there are a number of people that wrote extensive questions here, but I'm going to take administrator prerogative. And I'm jumping ahead. I'm going to go to Seraphima's question because she was so bold on her first time here to raise her hand. And so I want to honor that. And I'd like to go ahead and answer her question here. Okay. So Seraphima says, hello again, doctor. I have not had time to peruse your protocol, but I wonder if you have anything to say about exocrine insufficiency by Lyme migrating to a certain portion of the pancreas, mimicking pre-diabetic inflammation. 5.9 C-reactive protein test. Also, do you have anything to say about allergies to fish and poultry? Okay. So Seraphima, I have not seen, I've treated thousands of patients in my practice, literally, since I started treating in 2004, and I never saw anyone with tick-borne illnesses have a pancreatic insufficiency. I just haven't seen it, okay? Now, it's possible it's caused by tick-borne infection, but I haven't seen it. I will also tell you there is no science that has been conducted. No one's done research to say whether the pancreas gets hit by tick-borne infections or not. So what I would tell you is based on my clinical experience, I don't think it does anything to the pancreas. All right. That's just based on my clinical experience. All right. And then in terms of allergies, so in the world of allergies, there's something called alpha-gal, which is an allergy to red meat that happens if you're bit by a tick called a Lone Star tick. All right. Now, I want to clarify something. Lone Star ticks don't just happen in Texas. It's just they're called Lone Star ticks because they have a star on they have a mark on their back that looks like a lone star. That's why they're called a Lone Star tick. And they're actually found up and down the East Coast. They're down here in the South as well, too. I believe they're down here in the South. Anyhow, they transmit a sugar that looks very similar. They transmit a sugar that has very similar, or a substance, I think, which is sugar, that is very similar to a sugar that's found in red meat. And our bodies see that sugar, develop antibodies or immune reactivity against allergy activity against that sugar. And then when you have red meat, because it's already been primed because of what alpha gal gave you, or because of this alpha gal that the Lone Star tick gave you, then it will start developing immune reactions, allergy reactions to red meat. Okay. To be thorough, I'm just saying that I know you're describing fish and poultry, but I want to let you know that yes, there is a type of allergy that can happen to animal protein, but it's red meat, and it comes from alpha gal getting injected by a Lone Star tick, and your body, there's cross reactivity that sets up this allergy against red meat. Okay, red meat. So that could be beef, it could be, I do believe it's bison. I believe it may even be lamb is thrown in that too. Okay, all right. Now, when I see somebody, though, that has fish and poultry allergies, the combination together, that's a bit odd to have both. I start wondering what's going on in the intestinal tract. Specifically, the way your intestines are set up is you have the inside of the intestines where you have poop, basically, and undigested food, okay? Then you have a layer of cells, and then under this layer of cells, you have 70% of the body's immune system and blood vessels that absorb nutrients. All right. Now, in healthy functioning intestines, what happens is enzymes and acid, enzymes from your pancreas, acid from the stomach, and bacteria, healthy bacteria, microdigest your food down to amino acids, down to fat substances, and down to microscopic pieces of sugar that get absorbed into your cells and pass through these cells into your blood vessels. And because they're just amino acids, fatty acids, and glucose, the immune system doesn't think it's a foreign object. Okay. Now, you can get something called leaky gut, which is if you get too many yeast living on your intestines, or if you get another kind of infection that shouldn't be there, these cells that are supposed to touch up against each other very tight will plump up and pull apart, and you get gaps. And through these gaps, you get partially digested food that no longer is partially digested to its amino acids and its fatty substances and its sugar, but rather it kind of looks a little bit like corn, and you can develop corn allergies. Or it looks a little bit like fish, and so you get fish allergies. And so those substances come through, they hit 70% of your cells here, and one of the immune cells that sits here is mast cells. And mast cells are your allergy cell. All right. So it could be you independently have fish and poultry allergies. That would not be caused, I want to let you know, that's not caused by Lyme per se or tick-borne infections per se. But if you have been sick for a while, you've taken antibiotics, or you've ever taken steroids, it's possible that you've developed too many yeast in your intestines. And intestinal yeast overgrowth can lead to leaky gut. All right. So my suggestion to you would be take a look at, and I'll show you here where to look in a minute. Take a look at my article on how to diagnose intestinal yeast on your own. If you score high enough on my screening questionnaire, I would take a look at treating for intestinal yeast, and I'll show you where that article is as well too. Okay. In fact, I'll just do that right now here, just so you can see what I'm talking about. All right, so this is my Lyme information site, and in here on the online Lyme guide, if you look under the section called yeast, click on this article called A Silent Problem, Is It Yeast? And read through this, but you're going to want to take a look at my yeast screening questionnaire, and I talk to you here about how to use it and interpret it, okay? If you do have enough going on that suggests intestinal yeast, then the ideas that I have for how you treat intestinal yeast overgrowth, you would want to take a look at this article called Kills and Prevents Yeast, a brief guide, okay? All right. Serafima, did that get at your question okay for you there? Good. I appreciate your floating hearts and your thumbs there on your screen there. Thank you. Good luck to you. All right. Does anyone have a follow-up question to what I just said, answered for Seraphima there? And Seraphima, way to be bold. It's not an easy thing to jump into this group sometimes, so I'm glad you're here. All right, let's see here.
You have a question.
Yeah, Joe.
Yeah, I got Bartonella in 1992. It was only diagnosed in 2015, got different autoimmune diseases that supposedly diagnosed in between. But one thing that happened immediately in 1992 is I became so-called allergic to all chemicals. Like changing the windows in my house, not possible. Painting, not possible. Anything, being close to someone who wears perfume, not possible. It changed my life entirely. But that's one of the things that happened. And I wonder, it happened at the same time. Can it be a coincidence? It's still there. Or
yeah. So what I will tell you is this. There is a condition that can happen as a result of having tick-borne infections or intestinal yeast overgrowth or mold toxicity. And that condition is called mast cell activation syndrome. So your mast cells are basically the allergy cell, all right? We used to think that they only got turned on by allergens, things that you're allergic to. What we now know is that infections and toxins of any kind can turn these mast cells on to more easily release their histamines to anything.
Okay.
And that's called mast cell activation syndrome. I would take a look, and I'm just looking at our time here on the clock tonight. So it's 7:18 already. What I'm going to direct you to do, Joe, is take a look at my article, my resource I put together on mast cell activation. Okay. And it will give you an idea of what kind of symptoms come with mast cell activation and an approach on how you handle it. All right. And I'm going to pull it up here. Try to pull it up here. Oh, come on. Why are we not typing? Uh-oh. It looks like, I wonder if my keyboard just went dead. Hold on a minute. Yep, it went dead. Okay, good. I've got it hooked up again. All right, so it's this article called Mast Cell Activation Syndrome and Infections and Mold Toxicity, okay? Take a look at this. I wonder if you have become both chemically sensitive and environmentally sensitive due to your tick-borne infections triggering mast cell activation, okay?
Thank you very much.
Yeah, good luck to you. All right, let's see here. Tracy says, by the way, I wanted to thank you for your comments about a relative's thyroid testing treatment. You suggested using T3 instead of T4 in your final office hours. Were we able to get the doctor to agree that course of action? Thank you. Oh, good. I'm glad. Good. Good luck to them. All right, let's see here. Rid of that. All right. Hello, Rachel. Let's see. Hi, Dr. Ross. Thank you so much for all you do for us. What if you're very sensitive? Can you start slower with crypto? Thank you. Yes. So, Rachel, in anyone that is sensitive, I usually tell people to start low and slow. All right. And let me give you an example, just one example. So I had at one time a special ed teacher from Canada that came across the border to get my care when I was up in Seattle. And she had come down with tick-borne infections and was treated by a physician up in Canada and too aggressively treated. And she had severe herxes, and they kept pounding her with antibiotics and did not back down. As a result of that, she became overly sensitized to anything. She had documented Bartonella and Borrelia. And in the end, due to all of her sensitivity, I could only use herbal antibiotics, and I chose to use them because you could do drops.
Yes.
Right.
Okay.
I could dose her down to a level she could tolerate. And what got her well from her Bartonella and her Borrelia was, I think we got up to 2 drops twice a day. All right. And you know, I usually recommend 30 drops twice a day. So I'm just trying to make sure you understand the significance of this. Okay.
Yes, I'm at two drops right now.
Yeah. So we got up to 2 drops twice a day of Pseudoacuta hutania. I think I was using Otoba bark and cat's claw with her. So 4 things, but you could only do 2 drops twice a day. That's what we were able to get up to. We started only at 1 drop. Actually, I
Yeah.
think we started at half a drop. Now, in the way you do a half drop, you put a drop in water and then you divide that quantity of water in half. You have half a drop, right? And you swallow that down. But anyhow, we started really low and slow. Okay, now the thing is, I got nowhere near 30 drops twice a day on all of those. And yet, after 2 years of working with her, she got 90% well. All right. All right. So here's one of my theories. I think that happens in people that are very sensitive. I think part of the sensitivity could be mast cell activation. I just want to be clear about that. Okay. But another part is I think it's a detox issue.
Yes.
So ultimately, what you want to have is a drug level of your herbal antibiotic or prescription antibiotic that is there's enough in your blood to kill. All right. And what determines how much is in your blood is how much do you take, but also how much do you detox out. All right. So if your detox pathways are working great and cleans out what you took, you need to do a lot more on the front end, take a lot more to maintain your blood levels. But in people that are super sensitive, I think one of the reasons we can get by with 1 drop twice a day and get a person well is they get good drug levels just taking 1 drop twice a day. So yes, use your Herx reactions as a guide and don't push over it. You may have adequate treatment just with minor drops a day on the Cryptolepis. Okay.
Okay. Yeah, I've actually been treating for 13 years and I've had it way longer. I've been on IV,
Yeah.
Bicillin, everything, and I'm pretty much just shut in, homebound. I can't drive.
Yeah.
I haven't driven in 13 years, so I actually have went to printing out your guides for years, and now so I'm so thankful for you and everything that you do. And I don't know how to raise my hand either.
You're
So
fine. No,
on the glutathione, I go every week and actually get a IV push or whatever it is, like the 2000 milligram.
Yeah.
And I've been doing that for 2.5 years. Can that cause like Herx too? Because I'll get like fluey feeling a little bit. And
So the answer to that is it can give you a cytokine surge, which you're calling a Herx, but I want to make a distinction here. So,
okay.
All right. So keep in mind any of the symptoms, a lot of the symptoms, not any, but most of the symptoms you have from mold toxicity, tick-borne infections is due to the immune system, white blood cells manufacturing too many cytokines that are designed to turn the immune system on to deal with the problem. But because the immune system is not doing well, it makes too many cytokines. All right. And it's too many cytokines that make it so you can't sleep, make it so you can't think, give you fatigue. What we call tick-borne infection symptoms, what we call mold toxicity symptoms, what we call a lot of your yeast symptoms are excess cytokine symptoms. Okay. All right. Now, if you do something that, if you kill a lot more germs, the immune system sees the dead bug parts and it makes more cytokines. We call that a Herxheimer reaction when it's from germ killing. Okay. But you can also cause cytokine surges that are not related to germ killing. We don't call those Herx reactions. We just call it a cytokine surge. Okay.
Right.
Yeah. Now, what happens with glutathione is if you are a sensitive person, if you've got detox problems,
I do,
and your liver has been having a hard time cleaning out those toxins. What happens is you get a roadblock. You have a roadblock and you build up all these excess toxins. Okay. Now you take your glutathione, and what happens is the roadblock comes down just a little bit, and all these cytokines start moving through your body. You get cytokine really is like the movement of toxin. I'm sorry, all these toxins start moving, and the movement of toxins through your system triggers a cytokine reaction. So what I would suggest doing, knowing how sensitive you are, is find a level of your glutathione you can do that doesn't trigger worsening. There will be a level. You might want to ask your doctor if they could cut back the next time, do a quarter of what you've been doing and see if you handle that. And if you handle
I thought about Okay.
Yeah. So I would look at doing that. Okay. Yeah.
Thank you so much. I appreciate it.
Good luck to you. Oh, Rachel,
Yes.
because of the sensitivity, I suspect you have some detox issues. You know that. I
Mhm.
also would wonder about some mast cell activation syndrome in there too.
Yes, I've had some skin problems that I took pictures of, and
Yeah.
he did tell me I had that.
Okay. All right. So look at my article on that too and see if there's any ways you can help reduce that as well too. Okay.
All right. Thank you so much, Dr. Ross.
Good luck to you.
Thank you.
All right. Let's see. Hello, Sandy. Hello. I've been diagnosed with Candida parapus. I can never say this one in my lungs. I am currently on itraconazole and nystatin, as well as cinnamon, clove, oregano oil, grapefruit seed oil. I have noticed much improvement in my symptoms since I started previously mentioned medications. I was wondering what I could add to help break up biofilms. I'm taking Saccharomyces boulardii, also called Sacro-B, which will help break up biofilms, but I'm wondering if I could something stronger like Biodisrupt. Okay, so what I would suggest is the Sac-B is not doing anything for biofilms. I just want to let you know that. Sac-B can sometimes be used to remove, I'm going to blank, one of the mold toxins that you develop. Sac-B can help break down that one mold toxin. I'm just blanking on which one it is, okay? Sac-B is also, so Saccharomyces boulardii is a healthy yeast that populates our intestines. It's not Candida yeast. It's a healthy yeast, all right? And it can be very useful when people are prone to get C. difficile diarrhea, which is an overgrowth of a bacteria that normally lives in our intestines called C. difficile that grows too much when you're on antibiotics. And it releases a toxin that gives you this profuse diarrhea. Sac-B can help prevent that. And Sac-B can also help be part of a treatment for C. difficile diarrhea. The other time I like to use Sac-B is if I've got people that are just having diarrhea for any reason. Sac-B of all probiotics seems to do a good job of going after just diarrhea in general. Okay, so that's the reasons I do that, but I wouldn't use it as a biofilm breaker. To answer your question, what can you do that's stronger about breaking up biofilms? Yeah, add in the Biodisrupt. We talked about that earlier tonight, but I would suggest looking at that. Okay.
Yeah, can I ask a real quick question?
Yeah.
I was reading some research from the Journal of Fungi, and it basically was talking about Sac-B being used for a treatment and replacement for fluconazole and itraconazole, which is, I'm on itraconazole, yes. And the fact that it literally could break biofilms, it could stop the filamentous growth, it could stop the adherence. So that's kind of why I've been taking Sac boulardii, because I also was positive through immunoblot for Lyme and Bartonella. So I've been on Sac-B for a long time. And I figured, well, what the heck? I might as well keep with Sac-B because I now found that I have yeast in my lungs, which I think, is it fair to say if it's in my lungs, it's in my gut? Because they talk to each other.
I would think so. I don't know so though. Okay. And
yeah. I mean, I did your yeast questionnaire.
Yeah.
I mean, the very first two questions are 50 points each, and I hit both of those. So I started at 100. So I'm kind of screwed by this at the beginning, but
so what I was saying is you just educated me. I didn't know this about Saccharomyces boulardii. I'm gonna have to look into it a little bit more.
Yeah, look in the Journal of Fungi, and they did a bunch of research, and they're literally looking at it as a possible alternative if somebody is too sensitized to itraconazole or fluconazole.
Interesting.
And I kind of am intrigued with it because itraconazole tends to, like a lot of people, it irritates my liver. And as soon as it does that, I got to get off. Well, if I can stay on Saccharomyces boulardii, then at least maybe I'm doing something, but not to get gross, but what I'm coughing up, I'm swearing that's biofilm crap.
Maybe. So let me just address one thing about biofilms though. So you're
absolutely.
So there's two types of biofilm ish. So do you, besides the candida that you just wrote about, do you have tick-borne infections too?
Yes, I am immunobot. Well, I tested positive through the IGeneX test Immunobot for Lyme and Bartonella.
Okay, so here's the point I want to make. I am not aware of any science that says SAC-B breaks up Bartonella biofilm or breaks up Borrelia biofilm. All right.
Oh, okay.
All right. So I want to be clear. That is not something that most of us would grab for Bartonella biofilm or Borrelia biofilm. I understand you've got
Interesting.
science here that's saying it would go after Candida biofilm. That's fine. Okay. But so I would definitely, as you heard my discussion earlier tonight about Bartonella, one of my suggestions is biodisrupt to go
Okay.
after, and that's quite useful against Borrelia biofilm as well too. So if you're dealing with a couple of issues now, I don't know based on this research that's been done on biodisrupt, will it go after Candida biofilm? Likely it would, but I don't know. Okay, so that's the only thing I would caution you on.
So if I'm trying to break up biofilm that I think is in my lungs,
Yeah.
is biodisrupt appropriate to try? Because I need help breaking this stuff up.
No, I think it's appropriate. I mean, no, the other one that would be something to consider trying would be, and we talked about it briefly earlier tonight, is the product called Biocidin.
Yeah, that was the other one I was looking at.
Yeah, so Biocidin could give you some added benefit in terms of killing Bartonella and Borrelia. It can kill those, and in addition, the components of it work at biofilm at multiple different angles as well too. Let
So
me show
would
you.
you,
Yeah, let me show you
would,
an article where I describe. I'm going to show you my biofilm article because
okay,
in there I compare and show how it is that biodisrupt goes after biofilm and how biocidin goes after biofilm. All right, so let me see here.
so this is in your website and it's the one on biofilms, right? Oh,
Yeah,
okay. I
yeah.
remember
So this
seeing
one
that.
called
Okay.
Lyme Biofilm Update. I do believe that in here I talk about how it is that both biodisrupt and biocidin works. Okay, yeah, I address them in here. You'll see I address both of them here.
Okay.
In addition, for a really comprehensive review on biocidin and what it does, I have a whole article on biocidin, and I break down in detail how it goes after biofilms as well too. Okay.
Okay.
Yeah.
But I can add that to what I'm already taking to hopefully break up biofilms. And that's,
Yeah.
if I have biofilms up in my sinuses, which I'm pretty sure I do,
Yeah.
these will address issues no matter where they are.
It should. It should.
Okay. Awesome.
All right.
And by the way, I'm not Sandy, I'm actually Joanne Munns, but I couldn't get my computer to work.
Hi, Joanne. Good. Thank you for letting us know you're not who the thing says you are.
I'm really sorry, but it's a common mistake in our household. Thank you.
That's fine. All right, everyone. Listen, I enjoyed being with you here tonight, and I would hope that you all come back and join us again next week too. So we'll be doing this next week at same time on Thursday. Keep an eye out in your email tomorrow morning, somewhere in the morning, usually 9 to 9:30 a.m. Central Standard Time, Austin time. I will, well, not your email. Take a look at, if you're online, well, you all are on Lyme United. You'll get notified by Lyme United when I post the video in the Zoom area. All right. And as usual, I'll have a summary of what we talked about, at least by topic, so that you can hit the balloons on the timeline there and skip through to the thing you want to hear again. All right. And great. All right, everyone. Take care. Bye-bye.